What are the symptoms of cervical cancer?
The most common symptoms of cervical cancer are abnormal bleeding. So this abnormal bleeding can be very specifically restricted to saying a woman who is having a vaginal bleeding after having an intercourse, a woman who is having vaginal bleeding after attaining menopause, women who has bleeding in between her menstruation, apart from her regular periods, when she is having an abnormal bleeding in between, also is a symptom of cervical cancer. Then coming to other symptoms, it could be simply vaginal discharge, white discharge, or foul-smelling vaginal discharge, which brings the patient to the doctor, and she might be diagnosed with a CA cervix if the symptoms point towards the development of a carcinoma.
How is cervical cancer diagnosed?
Cervical cancer is diagnosed only by biopsy. The final diagnosis is only biopsy, but high suspicion on examination might provide a clinical diagnosis. So when a patient approaches with different symptoms of vaginal bleeding, abnormal vaginal bleeding, doctor examines the patient first. So on examination, when we find the cervix to be irregular, having growth, or abnormal on colposcopic examination, these findings might reveal a suspicion of cervical carcinoma, whence a biopsy is taken and henceforth proven to be a carcinoma. So ultimate diagnosis will only be a biopsy to prove that it is cervical cancer. But clinical diagnosis is a must so that a biopsy is done to prove that it is cervical carcinoma.
VS Hospitals. Care, cure and compassion.